I'm Greg Salisbury. I'm a physical therapist and I'm the program director of the Wound Healing and Hyperbaric Medicine program here at Community Medical Center. Chronic wound by definition is any wound that's not healed after 30 days. So if a typical injury happens where someone cuts himself with a knife per se, the body's normal healing happens within 3 to 5, maybe 7 days. That wound's gonna heal, but chronic wound healing is interrupted by a number of things. It could be circulation, it could be infection, it could be by the body's own comorbidities like someone living with diabetes or someone that has poor venous return or poor arterial flow. So anything can interrupt that normal wound healing process, and that's what we specialize in, those wounds that are festering and don't heal. We just had a patient who was trying to treat their wound for 15 months in another city. They were referred to us, and in 3 months that wound was healed. Yeah, to be clear, we treat all wounds. So we treat burns, we treat acute wounds, we treat pressure injuries, but hyperbarics is something specific for deep infected diabetic wounds with exposed muscle, bone, or tendon, or bone infections, or patients living with late effects of radiation therapy for cancer treatments, including anything that affects the bladder. So if anyone has any kind of bladder effects from radiation. And so those wounds are difficult to heal. But with hyperbaric oxygen therapy, we can heal those wounds, and we've had amazing success with all those wound types. Before this, I spent 16 years in the clinical field here in Missoula, and with wound care specifically, if we had non-healing wounds that fit those categories, we'd have to send them to Spokane, sometimes Idaho Falls. We didn't have any options, so that was a long travel cost. It was lodging, it was away from family, but now we can treat them right here in Missoula. We've been doing that for 9 years now, and we've had incredible results. Every treatment prescription is specific for the patient. So it might be 10 or 20 treatments. It might be 40 to 50 treatments. A treatment is Monday through Friday. It's daily on a weekday, and it takes about 2 hours, so it's a big commitment. But if it saves an amputation, or if it saves someone who has had long history of bladder control problems, that's worth it. So we are an advanced wound clinic, and what that means is we have access to some of the recent science for wound healing. It's advancing very quickly, and one example is skin substitutes, where we take products from the human placenta or the umbilical cord. Companies dehydrate that, they acellerize it so there's no cross-contamination risk. And for the appropriate wounds, especially wounds with venous insufficiency or diabetic wounds, we can put those on patients and we can heal them incredibly quickly, whereas they've been stalled before. The other thing is excisional debridements. If we have a wound that's covered in dead tissue, we have to remove that dead tissue so new tissue can grow. And so it's not a breeding ground for bacteria and infection. So that's a super important part for this wound healing process. Yeah, every patient that comes to us with a lower extremity wound gets a vascular workup. So we do one in the clinic called the ankle brachial index for patients that are appropriate. So we look to see how their flow going down to their toes is. We also look to see how the flow coming back is to make sure that that circulation is adequate. And step one in wound healing is if there's no flow, there's no go. So everybody gets that assessment. We can't heal wounds if they don't have blood flow going down. Hyperbaric oxygen does not work if they don't have blood flow going down. So everybody gets a vascular workup when they come in if they've got a lower extremity wound. Yeah, we're a one-stop shop, which is nice. We have, when you come in, you're gonna visit with our front office scheduler, who is incredibly welcoming. Our nursing staff is incredibly experienced. All of our providers are certified in hyperbarics and wound care. And you're gonna get access to infectious disease if you need it. You're gonna get access to nutrition if you need it. You're gonna get access to surgery if you need it, all in a one-stop shop at our clinic.